Hey guys, welcome back to my channel. My name is Bree if you are new here, and in today's video I want to do a Shop My Stash, but I'm going to do a special one. This month is Ehlers Danlos Awareness Month, which is something that I deal with, and I've talked a lot on my channel, particularly in Shop My Stash videos, so I will link that playlist in this video. I will link some of the videos throughout this video and have them linked down below as well. I've talked about my process of getting diagnosed with EDS on my channel. I started talking about it before I even knew what it was that I was going to be diagnosed with, but I've never actually sat down and talked about EDS in a more comprehensive way. I've talked a lot about my own personal experiences, but I wanted to do a video for EDS Awareness Month where I actually talk about the statistics and the symptoms and what it is. So I'm gonna do some makeup and talk about EDS. So if you guys are interested in learning about Ehlers-Danlos syndrome or just hanging out and doing some makeup, then just keep on watching. I'm gonna keep you guys zoomed out this video just because I don't want to have to focus on whether or not I'm in frame or out of frame or anything like that. I'd rather just have you guys more zoomed out and be in frame the entire time. If you're here for the makeup, as with every Shop My Stash video that I do, I'm not going to be talking about the makeup at all. I will have all of the products that I used in today's video linked and listed down below for you guys to see if you were curious. I also, in this video, am going to have some other resources linked regarding EDS in case you want to do some further reading. I'm also going to, you'll know because you've already clicked on this video, but I'm gonna say right now, I already know this video is going to be so long. It's so incredibly long. I wrote probably like a college essay length, like basically guide of what I wanted to say in my iPad, and it doesn't even necessarily include everything because there's definitely going to be some stuff that I have screenshotted or that I'm going to pull from websites simply because I was like, everything that I'm going to say is already on this website. I don't need to write it out if I'm just going to be reading the same thing, you know? But also here's hoping, because I do have it all written out, that maybe it's going to be a little bit more concise because I'm not going to be like struggling to find words. Okay, so let's just go ahead and jump into it. So EDS is a group of 13 connective tissue disorders. So they all have their own set of symptoms and like distinct features to them, but they will all feature some level of hypermobility, skin hyperextensivity, and tissue fragility. And I'll get more into kind of what that all means in just a little bit. So hypermobility is when a person's joints, and it could be one joint, it could be all of their joints, just a section of their joints, like a particular body part is more affected. It doesn't have to be everywhere. Basically, it's when that person's joints will extend beyond the standard range of motion. And now that doesn't mean that it always causes pain. For many it does, but for many it also will cause instability. And instability is basically when your joints aren't secure enough to hold your body in place the way that it's supposed to. So this could lead to what's commonly called subluxations, which is basically like a partial dislocation. Full dislocations, it can also lead to sprains and other issues. It also can lead to pain. A big portion of the pain, at least personally for me, but this is kind of general consensus that I have seen, a big portion of that pain comes actually with the muscles. So basically what happens, again, I'm going to use my own personal experience here. What happens is a joint will be really unstable and have a really hard time staying together and staying within the correct like range of motion, the normal range of motion. And the muscles will go into overdrive to basically protect that connective tissue that doesn't know how to do its job correctly. And in going into overdrive, you'll experience a lot of muscle rigidity. Like, for example, my trap muscles are rock hard. They have no like softness. Like, see here, you know, well, that's a bad position to put them in, but like, you know how like your muscles, when they're not flexed, they're squishy, right? They're not flexed. My trap muscles are basically in a permanent state of rock hardness because they're working so hard to keep my shoulder muscles, or to keep my shoulder joints in place. And again, for me, in my personal experience, that instability feels like, well, it feels unstable, but I experience it in the way that like I can feel my joints clicking and like popping and cracking. I can also feel them kind of sliding around, is the best way that I could put it. They kind of have a mind of their own. And the super fun part about all of it is obviously all of your muscles are connected and they work together. So not only is it my trap muscles that will hurt, but it will also cause neck pain, jaw pain, and a lot of times headaches as well. And here is where it starts to get a little bit tricky. Even though hypermobility is observed across all 13 subtypes, not every one with EDS will actually experience hypermobility. Another tricky part about it is as you get older, you lose some of that flexibility. And that's normal for everybody. Everybody in the world with or without EDS will experience that. But for those of us with EDS and issues with our connective tissue, every time we go beyond our range of motion, normal range of motion, every time we have a dislocation or a subluxation or basically any injury, no matter how small, it's causing micro tears in that connective tissue, which can go one of two ways, pretty much. It can swing far to one side where your joints become very rigid, very stiff, you lose most of your flexibility, or it can go to the other end of the spectrum and you will basically have nothing holding your joints together, and you'll be experiencing constant dislocations and constant instability because there's nothing to support them. So let's talk about skin hyperextensivity, because that is extensibility, hyperextensibility. I know how to speak words. I'm not a doctor though, because that is something that is also observed across all of the types of EDS, but again, not everybody is going to experience it. Basically what that is just your skin is stretchy. So it is measured by checking the inside of your arm on your palm side, and it is measured as stretching beyond 1.5 centimeters or beyond. In certain subtypes, it's even more severe and it will go beyond 2 centimeters stretchy. So just really, really stretchy skin. Other skin characteristics that are really commonly seen are what is described as velvety or doughy skin. So really, really soft, really just like, doughy is such a weird word and it's what's clinically used, and I have a hard time explaining it myself. But like literally when I got diagnosed, my doctor literally just felt my skin and she was like, yeah, you're really soft. And I was like, am I? This is the skin I've had my entire life. Like, I wasn't aware that I was particularly softer than others, you know? It's a weird one to try to figure that one out on your own. Same with the skin hyper stretchability. We're just gonna go with that. Same with the skin like stretchability, because it's one of those things that you're so used to. It's something that would have been a part of your body your entire life. So you're used to it, you know? You aren't, how do I explain it? It's just, it's not abnormal to you because it's the way your body has presented for your entire life. So when somebody starts asking you questions like, well, is your skin stretchy? And I'm like, I don't know. It's always been like this. Like, I thought that was normal, you know? Back to other skin related things that are typically seen with EDS. Skin fragility, poor wound healing, really thin skin too. So I am already very fair. I do have fair skin. I'm aware of that, and it's obviously a little bit easier to see on somebody who is more fair regardless. But a lot of times with EDS, again, not everybody, but a lot of times with EDS, the skin will seem almost thin and translucent. My body is effectively a roadmap for my veins. I can see basically all of them. Thin, translucent skin, skin that is very prone to damage. Scarring is very, very, very common. There's multiple types of different scarring that are common with EDS. One of them being atrophic scars, which are basically, they're referred to like cigarette paper scars. I don't actually have any of those, but it is something that is commonly seen where the skin is so fragile that it's effectively ripping itself, and then it's scarring and it's healing in a way that's almost looks like cigarette paper. Easy bruising is also very commonly seen with EDS as well, which just goes with like the tissue fragility and the fragility of the body in general. But yeah, like I myself personally, I scar so easily. I have so many, like this right here, that's a cat scratch. I have so many scars all over my hands and arms just from little teeny tiny baby scratches that won't even draw blood from one of the cats. I have them all over my body from the cats. It's just a more recent example because, like, I'm gonna be honest, I don't do a whole lot else, but like here's another example. I have my work desk where my computer is. I don't know how to explain it. It's not the most expensive desk. It's definitely not like a wooden desk or anything like that, but it has like those plastic pieces on the corner that like are made to attach the edging and the top. One of them is like kind of ever so slightly coming off. I was wearing pants, mind you, literally wearing pants, ran my leg into the desk where that little piece is popping off. It didn't even hurt that bad. Honestly, like it wasn't like a stop you in your tracks. It was just like, ooh, that kind of sucked, you know? Like, didn't really notice it too much. Went to go take a shower later. I was like, oh, that drew blood. Didn't rip my pants, by the way. Didn't even snag them. Literally drew blood though, and now I have a massive scar on my leg from where I ran into a desk. Easy scarring is very, very, very common with EDS. And so the thing with tissue fragility is, again, it's not seen in everyone with EDS, and there are certain subtypes that it presents a lot more and a lot more severe. And when I say tissue fragility, I'm not just necessarily talking about the skin. Organ fragility, vein fragility, muscular fragility, like basically any part of your body can be affected by the fragility of EDS. And a big reason for that is because it's a connective tissue disorder and your body is made up pretty much entirely of connective tissues. It can affect any part of your eyes, or it can affect any part of your body. Like your eyes, your gums, your, reproductive organs. It can affect everything. I'm gonna be honest with you, it is, as a complete side note, unrelated, it's very difficult for my brain to it's so weird because I'm so used to talking while I do my makeup, but something about trying to read something and make it back out into words for you guys while also simultaneously focusing on doing makeup. It's a lot, but I didn't want to sit here and just like read off stuff to you. Like, I'm still a makeup channel at the end of the day, but I have this, and I think that awareness is very, very, very important. I already know I'm going to have a hell of a time editing this. Let me get this shit blended. 1 second. Okay, so as I said at the beginning of this video, there are 13 different subtypes of EDS, and I wanted to very quickly go over the different subtypes and just talk about their general prevalence and some very, very base level common things that are seen within those subtypes. So the first one is HEDS, or hypermobile Ehlers Danlos syndrome. That is estimated to be about 1 in 3,100 to 1 in 5,000 people. This is currently the only version of EDS that does not have a known genetic marker. So they are currently working on finding the genetic marker for it, but it is the only one without a known genetic marker. And its hallmark symptoms are generalized hypermobility, joint instability, and chronic pain. The next subtype is classical EDS, or CEDS, and that is said to affect about 1 in 20,000 to 1 in 40,000 people. And I'm not going to get into the different genes that are affecting each one of these because there's several that are affected by each one, and I'm not a geneticist, I'm not a doctor or anything like that, but just basically know that every 12 of the 13 types of EDS do have targeted genetic markers that they can find to be able to diagnose you with these different types of EDS. And the hallmark symptoms of CEDS are skin fragility with extensive atrophic scarring, very, very stretchy skin with that velvety or doughy-like texture. Next one is VEDS, or vascular Ehlers-Danlos syndrome, and that is said to affect 1 in 100,000 to 1 in 200,000 people. And its hallmark symptoms are actually quite different than the rest of them. It is seen to affect the arteries. So hallmark symptoms would be arterial fragility with aneurysms, dissections, and ruptures, organ fragility and rupture, and pneumothoraxes. Next one is going to be one that I'm going to have a very hard time pronouncing, and that is arthrochalasia EDS, AEDS. So all of them are subtyped with letters, so it'll be a little letter, and then EDS is in caps. So for example, HEDS is H, and then big EDS. This one, AEDS, is said to affect approximately 1 in 1 million people, or less than 1 in 1 million people, and its distinguishing features are severe joint hypermobility, also congenital bilateral hip dislocations. So that is something that is very commonly diagnosed in infants. Next up is brittle cornea syndrome, which is actually just labeled as BCS. And that is, again, also seen to affect about less than 1 in 1 million people. And its hallmark symptoms are severe problems with the cornea of the eye and also hearing loss. Next up is cardiovascular EDS, or CV-EDS, and that is also less than 1 in 1 million people are seen with that diagnosis, and its hallmark feature would be severe heart valve insufficiency. And here is where we get into how some of the subtypes are actually kind of branches off of another subtype. So this is classical like EDS, or CL EDS. Again, seen to affect about 1 in 1 million people. This one also has the stretchy, velvety skin, but it does not have the atrophic scarring. It's also seen with foot deformities and leg swelling. How long am I going to spend blending these same 3 eyeshadows? Who's to say? Next up is another one that I'm gonna have a really hard time pronouncing, and that is the Dermatosparaxis EDS, or EDS, or EDS, and that is once again seen to affect less than 1 in 1 million people. And its prominent features are extreme skin fragility, craniofacial features, loose, excessive skin, severe bruising, and short limbs. Next up, we have kyphoscoliotic EDS, or KEDS. Again, less than 1 in 1 million people are affected, and its hallmark features are congenital early onset. I can't say onset for some reason. Early onset kyphoscoliosis and congenital hypotonia. I'm gonna be honest with you, I don't know what either of those are. I know what scoliosis is. I don't know what kyphoscoliosis is. Next up, we have musculocontractual EDS, or MCEDS. Again, less than 1 in 1 million people are affected, and it has congenital congenital multiple contractures, as well as craniofacial features. You have myopathic EDS, or MEDS. Again, less than 1 in 1 million people are affected with this one, and it has congenital hypotonia and proximal joint contractures. We have periodontal EDS, PEDS. Again, less than 1 in 1 million people are affected with this one as well, and it has severe, very early onset gum disease with tooth loss, and then pretibial plaques, which are a discoloration of the shins. 2 very separate, very different features there. All right, I'm gonna go through the last of these. Oh, there's only one more. And then the last one, which I also have a very hard time pronouncing, is spondylodysplastic EDS, or SPEDS. Again, less than 1 in 1 million people are affected with this one, and its distinguishing features are a very short stature, muscle weakness, limb bowing, so having like bowed legs, and then also craniofacial features. So those are the 13 subtypes of EDS. I'm gonna jump off really quick, put on a little bit of a wing. I'll be right back. Okay, so as you may have gathered from me talking about the prevalence of all of the different subtypes, HEDS, or hypermobile EDS, accounts for roughly 90% of all EDS cases. And even then, it is actually assumed that HEDS is underdiagnosed. I have seen discussion from different doctors and people like that the 1 in 5,000 number for HEDS is actually incredibly underrepresented and is more than likely something closer to probably about 1 in 500. So CEDS and VEDS are much more rare than HEDS, and all of the other 9 subtypes are classified as being ultra rare. And then there are actually a few subtypes that are only seen in certain affected families. So what causes EDS? In layman's terms, because again, I'm not a doctor, it's caused by variants in genes that are involved in the production of collagen. And like I said earlier, HEDS is the only one without a known genetic marker. They are currently working on clinical trials to figure out what the genetic marker is, but it hasn't been found yet. So I've already talked quite a bit about connective tissue. What is connective tissue? Connective tissue is found throughout your entire body, and it is what your body uses for support, protection, stability, and structure. And collagen is the substance that your connective tissue uses to create itself. It's the primary component of connective tissue. How do you get EDS? So it can be passed from parent to child. It is a genetic condition, so genes are involved. However, it is possible to have a de novo mutation, which basically means you would be the first in your genetic line to have that variant. It is seen and it is possible to basically be the first one, but more often than not, it is a genetic condition that is passed throughout a family's line. And it is possible for someone to just be a carrier of the gene without actually experiencing any symptoms for it. It also is a spectrum. EDS is a spectrum, particularly HEDS is a spectrum, but it's all a spectrum. And some members of a family could have severe symptoms, while other members of that same family who have that same gene mutation, that variant, could have very, very, very mild symptoms. So it's a big spectrum on the symptom line. So it's entirely possible for you to be like, oh my God, like I am the de novo variant, and come to find out your mom and your grandma and your great grandma all had it, but they had more mild symptoms, or they learned how to deal with their symptoms early on, or maybe they were just somebody who was taught growing up like, oh, you're too young to be in pain. Oh, you just, push through it. I think that's personally, again, it's a personal experience here. I think that is a big reason why we are seeing a lot more younger people being diagnosed with EDS as opposed to older generations. I think that there's a generational divide between just put your head down and work, like just push through, pull yourself up by your bootstraps, versus younger adults and younger kids are feeling things within their body. They're more likely to interact with people online, see things that are different than their own body, maybe be able to have kind of more of an idea of a baseline from friends or something like that, and be able to sit down and go, hey, this thing is different about me, and look into it or have discussions with family, friends, things like that. Younger generations are just a lot more open about the issues that they have, whether it be mentally or physically. And I think that honestly is a big reason why we're seeing a lot more younger people diagnosed. Is A, there's just more awareness, but also B, people are just more willing to actually figure out what the fuck is going on with them, How do you get diagnosed with EDS? So each subtype has their own diagnostic criteria, and genetic testing should be done to complete that diagnostic criteria. It's not available for everybody. It's not accessible for everybody, unfortunately. There is also a worldwide shortage of geneticists, which does hinder people's ability to see a geneticist. But generally, genetic testing should be done to complete the diagnostic criteria. And then the big question of, what does someone do if they have symptomatic hypermobility? It's causing them a lot of pain. It's causing them a lot of instability, but they don't meet the genetic markers, or they don't meet the diagnostic criteria. In cases like that, people are typically diagnosed with what is called HSD, or hypermobility spectrum disorder. Hypermobility spectrum disorder is treated the same as HEDS. They have very, very similar features, and I will discuss that a little bit more down the line, but they're given the same treatment. So the same steps to help are the same between HSD and HEDS. So let's talk about treatment. There is no specific treatment or cure for EDS. It is a lifelong condition that you have to just manage basically for the rest of your life. There are certain things that can be done between all different subtypes. Every subtype has their own treatment plan, but there are certain things that can be done to help manage symptoms or to treat things that can come up as a result of EDS. Typically, that is multiple different things, so you're going to be dealing with multiple different doctors of multiple different specialties. All right, so let's talk about the difference between HSD, hypermobility spectrum disorder, and HEDS, or hypermobility Ehlers Danlos syndrome. So without a definitive test for either, there's truly really no way to differentiate between the two. Both have very similar presentations, and like I said earlier, both have the same treatment plan. And honestly, some experts actually do believe that they're the same, just on a spectrum. So when discussing treatments, as I said earlier, a lot of times it can come with multiple different doctors from multiple different specialties because, as I said, there's no cure for EDS. You just have to treat each individual's symptoms. And a lot of those symptoms are coming from the comorbidities of EDS. So basically, a comorbidity is a completely separate diagnosis that is very commonly associated between the two. So there are certain things that you will commonly see linking two separate diagnoses together. And this is not just an EDS thing. This is common with many, many, many other types of disorders and diseases and disabilities and illnesses. For example, it's very common if you're someone with OCD to also be diagnosed with depression. Those are comorbidities because while they are separate diagnoses, they tend to come together. So let's talk about some of the comorbidities of EDS and common things that are seen together. This is another word that I have a very hard time pronouncing. Dysautonomia. Actually, I think I said that correctly. Look at me go. Dysautonomia. So basically it is a dysfunction of your autonomic nervous system. The most common one is POTS, postural orthostatic tachycardia syndrome. I actually was just recently diagnosed with POTS, and if you want to hear a little bit more about POTS and a little bit more about my process of getting diagnosed with POTS, I will link my most recent Shop My Stash because I talked about it at length in that video. But POTS is very, very commonly seen with EDS patients. There's another one later that I'm going to talk about. It's another comorbidity that's commonly referred to as the trifecta, where it's very, very, very common to see EDS, POTS, and then MCAS, or mast cell activation syndrome, diagnosed together, all three of them. There's being some research done on how the three are very interconnected. Moving on. Gut dysmobility, or honestly a lot of other gut related problems like IBS in both versions, acid reflux, GERD, gastral reflux disease, GERD, you know what I mean. But gut dysmobility is one that is seen, which would also typically be referred to as gastroparesis, which is basically where your intestines and your stomach situation moves very slowly, and it does not process food at an appropriate speed and can make you very, very ill. Chronic fatigue, which doesn't really need much of an explanation. You're just chronically fucking tired. Small fiber neuropathy, which involves the nerves sending out bad signals, and you experience a lot of pins and needles and numbness, things like that. CCI, or cervical cranial instability, which comes a lot with neck hypermobility, and another one that's not nearly as common but is kind of related would be Chiari malformation. I'm not 100% sure how to spell it or how to pronounce it. Is another common one. Or CSF, cerebral spinal fluid leak, is also one. Again, not common by any stretch of the imagination. There are certain comorbidities that are much more common and much more noticeable. Not noticeable. They're just more commonly seen with EDS. Things like CCI, CSF, gastroparesis, those are not as common. They can be seen, but they're not seen nearly as much. Sleep disorders is also very common with EDS. Same with, honestly, anxiety and depression are super common with EDS. And personally, that makes sense to me. Living in pain, living with things wrong with your body on a constant 24/7 basis, it makes you anxious. It really does, especially when you don't know what's wrong with you. It definitely causes a lot of anxiety. It can also cause a lot of anxiety in the way of, at least for myself personally, I struggle with anxiety around, and this is honestly probably a lot of OCD at play here as well, but a lot of anxiety around, okay, is this thing that I'm experiencing, this pain that I'm experiencing, is it EDS or is it something else? Is it something fatal? You know, that is like quite a big fear of mine, actually, that I will brush off something that needs immediate emergent care because I brush it off as, oh, it's just EDS. You know, that is a fear of mine. And then on the other end of that spectrum as well, when you're dealing with chronic pain, you're dealing with joint instability, you're dealing with these issues that are affecting how you're expected to function in your daily life, how you're expected to present yourself, how you're expected to go to work. When you have something wrong with you that impacts that, it causes a lot. It can cause depression. You know, it is fucking depressing to just be in pain all the time, to have plans and to not be able to fulfill them because you're out of commission that day. That's fucking depressing, honestly. The one that I briefly touched on earlier, which is MCAS, mast cell activation syndrome, which involves basically your body overproducing or overreacting to histamines within your body. Other comorbidities are things like bladder issues, hernias, prolapses. Those all come with the fragility of the tissues. You have cardiovascular issues, even with what I think is typically like almost kind of misunderstood as HEDS being one of the more less serious versions of EDS, which again, it is a spectrum. Some people have severe mobility issues. Some people can function almost basically as normal. It fluctuates from person to person, but even with HEDS, it is commonly seen to have mitral valve prolapses, as well as uterine prolapses of other things. That is commonly seen with HEDS even. Oral health issues are a big one. Connective tissue is in your gums. It's in your teeth. It makes everything function. Another hallmark thing with HEDS in particular, but I would assume probably some of the other subtypes as well. I personally have done the most research on HEDS because it's what I deal with. Dental crowding is very, very common, as well as like a very high, narrow palate. For myself personally, as a child, I had to have permanent teeth removed because they didn't all fit in my mouth. And I actually had braces 3 different times, and all 3 times it didn't stick because my teeth were so crowded in my mouth that it wouldn't work. I ended up having to get crowns on my front 6 teeth just to get them to be straight. I'll be right back. I actually ended up having to get crowns on my front 6 teeth, not only because they would not stay straight, but also because years and years and years of braces and other orthodontic situations led to pretty severe decay on my teeth because of what I've now learned is because of EDS. Reproductive organ issues, endometriosis is very commonly seen, as well as adenomyosis. Is that how you pronounce it? Not 100% sure, but yeah, both are very commonly seen with EDS as well. And in addition to that, there has also been some discussion, it's not been clinically proven yet or anything like that, but there has been some discussion about the link between EDS and neurodiversity. It's pretty common to see people who are diagnosed with autism spectrum disorder, attention deficit hyperactivity disorder, ADHD, OCD, also diagnosed with EDS. I don't know what the link is. Hopefully one day they can figure it out, but I do find it very interesting as somebody who is neurodiverse to find out that there is a link between them. So what are some treatment options? Again, as I've said multiple times now throughout this video, treatment options have to do with your own individual symptoms. A lot of treatment is going to be for those comorbidities. If you have POTS, you're on beta blockers, or you're increasing your water and your salt and electrolyte intake, you're wearing compression garments, things like that. If you have gastroparesis, you're in treatment for that. If you have endometriosis, you're treating that. The majority of treatment for EDS comes with treating those each individual symptoms. When it comes to treatment for actual EDS, for treating the hypermobility, treating the joint pain, there's honestly unfortunately, there's not a lot that can be done. The gold standard treatment is physical therapy, with the belief and the understanding that strengthening those muscles is going to be able to provide support and stability to the affected joints. So for example, in physical therapy for my shoulders, I am working to strengthen these muscles right here and also these muscles so that those muscles can basically provide the support that my connective tissue doesn't. Many people with EDS of all different subtypes use mobility aids. Some don't need to. Some don't need to right now, but they may down the line. Some may right now, but they may hit a point of effectively remission where their muscles are strong enough that they're able to support their own joints without the use of a mobility aid or something similar. Each individual is obviously very different in that journey. Some people use canes, walkers, wheelchairs. There's also a lot of support items that can be used, such as braces, obviously wrist braces, elbow braces, shoulder braces, things like that. There's another thing that's commonly used for hand hypermobility. They're called ring splints, which are basically like rings that are in like almost figure eights, and you wear them over your joints, and it provides you the ability to, do this, but it stops your fingers from going too much the opposite way. KT tape is another thing that can be very, very helpful. The problem with things like KT tape or anything that has an adhesive to it is if you're somebody that does have that tissue fragility, that skin fragility, or you happen to have something like MCAS where you are having allergic reactions to things on your skin, the adhesive in KT tape can cause problems. But if it's something that works for your skin, or you maybe have an effective way to remove it that doesn't, rip off layers of your skin, KT tape is great because it just basically provides joint stability in place of connective tissue and in place of where your muscles aren't. So there are a lot of different things that can help outside of just medicines. Obviously, there's tons of different medicines that can be used. That's a speak with your doctor kind of thing. Each person is going to have their own experience with medications and what they choose to use to help themselves, whether that be over-the-counter pain medications, pharmaceutical medications. I guess technically they're all pharmaceutical, but you know what I mean, the kind that you have to get from a pharmacy, muscle relaxers, what else is there? Tons of other different types of medications, obviously. But there are things that can be done to kind of help you without having to take medications if it's something that you're maybe more intolerant of medications. I am somebody who has a hard time tolerating different medications for a number of different reasons, but I tend to have a lot more side effects from medications, so I just kind of raw dog life, you know, because that's kind of what I have to do, and just take like over-the-counter pain medication when I absolutely have to. Okay, I'm gonna go quickly set down the rest of my face, and then I figured I could talk a little bit about my own personal experience with EDS in kind of like a one place. So as I said at the beginning of this video, I have talked kind of almost at length throughout multiple Shop My Stash videos about my own experiences with EDS. I started doing those videos when I was in the process of getting diagnosed, so I talked a lot in those videos about that process, and you know, I also did I think a video or two where I talked about like almost, it was kind of my way of processing like this is what this is, right? So I will, like I said at the beginning of the video, I will have those linked throughout this video if you guys are interested in that. But just kind of like my own general experience with EDS, I realize now as an adult that I was hypermobile my entire life. I did do a lot of like party tricks, and I was very bendy, and I'd be like, oh my god, look at what my elbows can do, like they go way beyond the range of motion, and I'm double jointed and all of this kind of stuff. But it wasn't something that presented issues at the time. I was born with pectus excavatum, which basically means that my chest wall is like this. It's not very, very severe. Honestly, it's not even noticeable on my body now that I have breasts. I just gave my A cups bitchin' cleavage. In hindsight, that is a connective tissue issue to have your chest bones sunken in. Doctors asked my mom when I was born, they were like, hey, do you want us to crack her chest wall and fix it? And she was like, fuck no, absolutely not. So, you know, there's that. I was a very bendy kid. I didn't have a lot of issues from it. In hindsight, I mean, it definitely didn't help me in the long run, because every time I was doing those little party tricks, every time I was causing micro tears and damage to my joints and my connective tissue, which is probably a big reason why I have much more significant pain now as an adult, but it didn't cause me problems as a child, so it wasn't something that was investigated, and honestly, it wasn't even something that was even on my radar as, hey, these two might be linked. You know what I mean? I had a lot of sprains as a kid. I had issues as a kid, which in hindsight were related back to EDS. It was just chalked up to like, ah, she's a fucking kid, you know? The other thing that doesn't help is, while they are not diagnosed, I honestly have a pretty strong belief that my mom and my grandma, at the very least, both have it. My grandma is nearly 83 years old. She'll be 83 this year. She uses a walker to get around. She uses mobility aids and things like that. But at her age of 83, she can still bend over, knees straight, and palm the floor. She can even palm the floor with the backs of her hands. I can't even do that. That's not something that I can do. Now, to be fair, I am also a toe walker. Could be EDS related, could be neurodivergent related. Could just be that I never really learned how to walk correctly. Who's to say with that one? But being as though I have been a toe walker for 30 years of my life, my tendons and my muscles are a little bit shorter in my calves, and my feet and legs in general. So the process of bending over, not the best for me. But the fact that my grandma can still do that, both my grandma and my mom have had chronic pain my entire life. A lot of my chronic pain symptoms mimic their chronic pain symptoms. For example, my mom and I both have had chronic costochondritis, which is technically the medical definition of it is like inflammation of the chest wall, but it's just basically like pain in your sternum and your ribs, which is fucking terrifying when you don't know what it is and you're like, oh my god, I'm dying. But my mom has had that for my entire life. My grandma has had a ton of knee problems. My mom has had a ton of knee problems, hip issues, things like that. So a lot of my chronic pain mimics theirs. So with that, you grow up assuming what is normal for you based on what you see around you. So while maybe my mom and my grandma weren't like doing fucking party tricks and shit like that, my cousins were all in gymnastics. Like, I was in dance. I brushed off that flexibility and that hypermobility as normal for me. So when it came to my adult life and it was time for me to actually genuinely like start to figure out what the fuck was wrong with me, hypermobility wasn't remotely on my radar. So the pain didn't really start for me until I was in my early 20s. And it started out with sporadic episodes of costochondritis, but they were often enough to be considered chronic. The best way that I could personally describe costochondritis as to somebody who doesn't have EDS and how it affects somebody without EDS is very similar to tennis elbow. So that constant movement that you're doing when you're playing tennis, and it's inflamming? It's causing inflammation in your elbow, and then it hurts really bad when you're doing that motion, right? Because you've done it too much and your joint's like, yo, chill the fuck out, and then you rest it and then you're fine, right? Yeah, see, the thing about that is the constant movement of your chest wall is breathing, and you can't really rest that. So that's like problematic. And honestly, we just kind of also always assumed like, oh, maybe it has something to do with the sunken chest. Oh, well, my mom has it too, so maybe it's just like a thing that we deal with. It was in fact a thing that we deal with. But you know what I mean? Like, it wasn't, I was in my early 20s. I got a couple like EKGs and like workups the first couple times, but it was typically written off as you're too young to have anything wrong with you. Well, there's nothing wrong with your heart or lungs, so you're fine. Oh, it's just growing pains. Like, you'll be fine. Oh, it's just anxiety. You need to go to therapy. That was a big one. That was one that I got a lot, because stress doesn't help. Stress does not help inflammation in the body. People were assuming that I was in pain because I was just fucking stressed and anxious. But no, I was stressed and anxious because I was in pain. It was a vicious cycle. Anyways, but again, it was sporadic. It wasn't constant. And I definitely can remember when I was younger, issues where it did flare up with stress. Stress does not help. When I get overly stressed now, I have joint pain. I have POTS flares. I have EDS flares. Stress does not help the situation. Like, for example, my mom had surgery when I was in my early 20s, and I like tried to go to work a couple days later, and I had to leave work because my chest hurt so bad. Could have been a stress response. It could have been from when I was trying to help her get up out of bed and I, overexerted something. It could have been something I did at work. I don't know. I don't remember. It was like 10 years ago at this point. That is one thing that sticks out in my mind. Couple years later, the chronic pain started, the daily pain started, and it started in my neck. So it was daily. And it did fluctuate. It does still fluctuate in severity. I have days where it's not so bad. I cannot do this and talk at the same time. So yeah, it'll fluctuate in severity. Some days it's really, really bad. Some days I feel mostly okay. It's like a dull roar. For example, today it's a dull roar. I am mostly okay today. Now, to be fair, I have had the last 2 days off. I had a 3-day weekend, so that probably plays a part in it. Yesterday, though, I wasn't doing so well. It comes and goes in waves. But again, doctors still had no definitive answer, and hypermobility still wasn't on my radar as a cause. I wasn't aware of the fact that my neck was hypermobile, that my neck goes too far fucking that way when I look. I wasn't thinking about stuff like that because it wasn't something that was talked about very often. It wasn't something that's brought up during physical exam. And myself personally, I think that if you're having a young patient come in and they're presenting with chronic pain, particularly in their neck, their shoulders, their hips, their knees, things like that, their chest, and standard workup is showing no issues with their heart, their lungs, they're not, blowing a fucking blood clot, stuff like that, the non-emergent things. I do think that hypermobility should be discussed. Just a quick hey, can you just do X for me really quick? I just want to see how hypermobile are you? Is that what's causing your problems, kind of thing. Instead, I was typically brushed off as being, again, too young to be in pain. You're so young, you can't possibly be in the pain that you're in. Or I was sometimes brushed off as being drug seeking, which is delightfully fun. And I started leading my appointments with, I have no interest in opiates. I have no interest in medically treating this. I just want to feel okay, but I also mostly just want to find out why. Because here's the thing, at least personally for me, I lived with chronic pain, still, but at the time, lived with chronic pain for so long of my life that it just became normal. It became this fucking shit that I dealt with on a daily basis. So it almost just became part of what I dealt with, and it just was what it was, So at some point, aside, obviously the idea of, okay, is this something that we can treat? Is it something that we can make better? Is it something that can go away? Obviously was there. I would always like to not be in pain. I would love to know what it's like to go through a day without experiencing pain. At the root of it all, I just wanted to know why. I wanted an answer, an explanation as to what it was that was causing these issues. I had several doctors try to tell me that it was simply because I looked at my phone too much. It was simply because I was too thin, too inactive, too this, that, everything else. Never mind the fact that I am not thin by choice, but never mind the fact that I am inactive because I'm quite literally in too much pain to be active. I don't have the physical capabilities to go and exercise and weightlift and do this and do that. That's not. And I mean, technically they were kind of on the money with the too inactive, because the whole physical therapy being the gold standard and strengthening your muscles thing, they weren't too far off with that one, but it wasn't they weren't saying it in a way that they meant oh, this will help you. They meant it in a condescending kind of way. I'll never forget the last doctor that did an x-ray of my chest and my neck, pre-diagnosis, right? And she calls me when she has them all the imaging done, and she's like, "Did you know that your chest is sunken in?" And I was like, "Yeah, it's been there my entire life. It's not new. I was a child once. It's always been there." And now at this time, or even long before this, I didn't know of somebody who has EDS. But the thing is that they use mobility aids. And so in my mind, I automatically correlated the two together. Oh, this disorder requires mobility aids, kind of like how insulin, or kind of like how diabetes requires insulin. I don't even think it requires insulin in every single case, but you know what I mean. You see someone using insulin, so you automatically correlate that to diabetes, right? So it was never really, again, EDS was never on my radar. And like I said, you deal with certain symptoms for your entire life, and you see other people in your family experiencing the same symptoms, so you just kind of assume oh, okay, that's just normal, going back to the skin flexibility and the skin softness thing. I remember when I had my first appointment with my geneticist, and it was a phone appointment, and we were just kind of going over family history and everything like that, but we did briefly touch on the Beighton scale, which is used as part of the diagnostic criteria for HEDS. And she was like, is your skin particularly stretchy? And I was like, bro, I don't know. This has been my skin my entire life. I don't typically walk around pinching and pulling other people's skin to understand baseline. Same with skin like softness and like that velvety like skin. I don't walk around petting other people, so I don't know like what is baseline on that, you know? Like your baseline is what you've experienced your entire life. So when it comes to like those kind of more vague questions, you start to just assume that you are baseline when it turns out that you're not. So in 2021, I had a really, really bad flare. It happened when I was helping to take care of my then 3-year-old niece, my best friend's daughter, for about a week while they were moving back here. Lola just started squeaking. She's like, do not mention that child around me. Anyways, she was 3. Toddlers are a fucking handful, bro. Like, oh my God, they're a fucking handful. You know, they still like to be carried, but they also like to be just like thrown around, and you know, you gotta pick them up to put them in the cart before you go into the grocery store. You gotta pick them up to put them in their car seat. You gotta, you know, do all of this and that. And they actually hadn't lived locally to me in a little over 2 years. So she was just about to turn 1 when they moved away, and she had just turned 3 when they moved back. I spent 2 years of my life, I saw her a couple times, but also there was like a whole pandemic in there, so didn't see her as much as I probably would have otherwise. But I went from lifting her constantly as a baby to never lifting her at all to suddenly now lifting her constantly. And I wasn't her sole caretaker during that entire week. She went back to her grandparents at the end of the day, but even 8 to 10 hours of taking care of her in a day was way too much for my body. And it caused probably what I would consider to be my most severe flare to date. And it was while I was laying in bed, crying, sobbing in pain. And now, mind you, this was a pain that I had experienced before, and I had had flares of that level, maybe not that high of a level, but I had had similar flares before. So it wasn't something that I was like, okay, this is like an emergency room visit. It was one of those like, need to go to the doctor, but it's not like, I'm not dying kind of thing. So, but I'm, you know, laying in bed, suffering, crying, sobbing, all that great stuff. And that's when I decided, like, okay, it's fucking time. I need to put my head down and figure this out. We need to figure out what's wrong with me. And in my mind, I'm like, I've had so many conversations with doctors throughout the years, and I'm telling them that I'm in this much pain, and I'm explaining this pain to them. And at no point is anyone ever like, let's figure this out. Like, let's figure out why you should be in pain. I start going to doctor's offices and doctor's appointments, and that was when I got that x-ray on my my neck and my chest. And it was around this time as well that TikTok, good old TikTok, started showing me EDS, Ehlers Danlos, and hypermobility and things like that. And again, it was one of those, like, I saw a couple videos and I was like, okay, that's interesting, but like, as far as I know from my own personal worldview, it requires mobility aids, and it requires this, and it's, you know, this. And I had my own preconceived notions of what it was, obviously. In my mind, I'm thinking, like, nobody ever talks about this, so it's gotta be super rare. Like, it has to be super, super rare. Like, there's no way. What are the odds, right? Like, what are the odds that I have this super, ultra rare disorder, right? As everybody has said 1,000 times over, the TikTok algorithm always knows you better than you know yourself. You hover on a video for just a little bit too long because you're like, damn, I relate to this. And I started seeing a couple more videos and a couple more videos, and I was like, okay, I am relating to what these people are saying. And I wasn't taking any of these TikTok videos as like doctor advice. I wasn't taking them as, you know, Bible. I wasn't, in my mind, it was, okay, it's something to look into, but it's probably not that, but it's good to check it off the list. To just mark it off the list as, okay, we looked into it, it's not that. So I started doing a little bit more research on my own, kind of just general research, reading a lot of, honestly, what I've talked to you guys about earlier, through reputable websites and things like that. And it was at about that point that I was like, maybe what it is? I don't know. Again, wasn't set in stone, was still in that kind of position of like, it could be or it could not be. I just want to mark it off the list, pretty much. And okay, we knocked one off the list, let's move on to something else, if that's not what it is. I was never dead set on it being EDS. I never like self-diagnosed with EDS or anything like that. It was just something that I found interesting and I figured would be worthwhile to discuss with a doctor. That's basically where I was, you know? So from there, it took nearly a year and a half to get someone to actually listen to me, in a meaningful way, at least. Again, I'm not going to get too into like my diagnostic process and everything like that, because I have talked in length about it on my channel, and also because this video is 7,000 years long. But I did have a doctor that I had an appointment with. It was a new primary care doctor, because I'd had the same primary care doctor for quite a few years, and while she was fine, I just wanted some fresh eyes. Maybe somebody would have a better idea. Maybe they would know something about something that that doctor didn't. Or, you know, just simple things like that. But also there was just that part of me that was just like, this woman has heard me say for years now that I am in this level of pain and it's not being taken as seriously as I would like it to. So it's time to move on to a different primary care doctor that will actually take my complaints seriously. You know, you don't know much about a primary care doctor when you first pick them, obviously. You kind of just have to go on fucking vibes of like a name and a bio and sometimes a picture. And that's all you got to go off of. So I picked a new primary care doctor, went in for a standard checkup appointment, and said, hey, I'd like to be evaluated for EDS. You know, here are the ways in which I think that I could possibly meet the diagnostic criteria. I'm not, you know, set in stone on it or anything like that, but it's something that I would like to look into, and then we take it from there. And immediately I was met with, you're too old to have EDS. If you had EDS, you would have been diagnosed as a baby. There's no way that you have it. She tried to check the stability of my shoulders by literally just going like this, and I was like, what the fuck is that supposed to accomplish? Like, I kind of kept pushing with her, mostly because at that point I was A, frustrated, and B, kind of already knew like, okay, I'm not going to be sticking with this doctor, so I'm gonna find a new one. So if I burn this fucking bridge, well then I burn this bridge. And so I kind of just kept pushing it in that appointment, and I was just like, look, like, I just want to rule it out. Rule it in, rule it out. Either way, don't really care. Not attached to the idea. I have no emotional attachment to the idea of being diagnosed with EDS. I just here for some fucking answers. That's it. And weirdly enough, she ended up saying like, okay, well, I'll refer you to genetics and we'll go from there. But I don't think that that's what you have. And I was like, genetics is all that I'm asking for. Basically, to make a very, very, very long story short, genetics simply asked her to do the bite and scale on me prior to them having me come in. They need some kind of baseline to work off of to know whether or not I would be a candidate to even get the genetic testing, you know? And again, HEDS doesn't have a genetic marker, but they just wanted to know if it was even basically worth their time to test me for the other types. She refused to do the bite and scale on me. basically told me that genetics said that there was absolutely no genetic testing possible for EDS. Not HEDS. She said for EDS in general, as in all 13 fucking subtypes. And that lit a fire under my ass. Again, at this point, still not attached to the idea it being EDS, but now very attached to the idea of proving a point to her. Very attached to don't say you're gonna refer me in and then basically take away your referral. I contacted the genetics department myself. And I explained my situation, and I explained everything that I was told by her, and they were like, let's get you a phone appointment with the geneticist. How about that? We'll start there. And so I have this phone appointment with the geneticist in which I explain, like, go over my whole family history, my, you know, everything. Go over everything. I vividly remember saying to the geneticist, we talked on the phone for like an hour, I don't even think it's EDS. I don't care whether or not it's EDS. My point is, if a patient is telling a doctor that they are living in 4 to 6 on the pain scale every day with multiple flares a month, that they're hitting 7, 8, 9, why wouldn't you want to figure it out? Why wouldn't you, at the very least, want to figure out what's going on with them? What's the harm in ruling something out if it just means that it makes the list of possibilities a little bit shorter? That was my whole thing. And she absolutely agreed with me, and she said, let's rule it out. She even, at the end of that appointment, referred me into physical therapy just so that I could start trying to feel a little bit better. She referred me in to get genetics testing and everything like that, just based on some family history that I had with other people in my family, you know, possibly showing signs of other versions of EDS. Side note, by the way, I sobbed after that phone appointment because it was wild to have a doctor that actually listened and cared. That was a new experience for me. I did the genetic testing. I don't have any of the variants that are related to the 12 subtypes that do have a genetic marker. So that was marked off the list. And at this point, I had not yet physically seen my geneticist in person. We had only spoken on the phone. Let me go do my lips really quick and then I'll come back and we'll finish this whole thing up. So basically, when I was on the phone with her after my genetics results had come back, and I still hadn't seen her in person, she pretty much just said, I can't clinically diagnose you because I haven't seen you in person, but I have a very, very strong feeling that it is hypermobile Ehlers Danlos syndrome. What do you want to do? A clinical diagnosis at that point wasn't going to change a whole lot. I already had a referral into physical therapy. I had already done quite a bit of research, and she had personally educated me on a lot of kind of how I was going to function in my life on a day-to-day basis and what I needed to do to help myself. And I said, you know what, I think that in the long run, having that clinical diagnosis, that thing on my chart that basically says this is what it is, it's going to help me in the long run. If I have to go to the doctor or for whatever reason, or if I need to ask for accommodations at work and things like that, I do think that having that clinical diagnosis like written on my chart, rather than just being like, yeah, this is what it is, but like you have no written proof, like a doctor wouldn't have any written proof in my chart, I think that would be beneficial. And she was like, I absolutely agree. So I made an appointment and I went in and I saw her. So in that appointment where I actually went in, because at that point I had not been clinically given the Beighton scale, I'd kind of just done it over the phone and told like my own personal, you know, assessment of it, which again is, that's not a reliable source because I'm not a doctor, I'm not a geneticist, I don't know what the fuck I'm talking about. We went in and I spent probably about another hour there at that appointment, where we went through the whole Beighton scale. I'm going to speak briefly on my own personal opinions of the Beighton scale. It is very outdated in my opinion. My geneticist echoed very similar sentiments. The Bite and Scale does focus very heavily on the small joints of the hands, the wrists, the elbows, the knees. I don't have a lot of hypermobility in my hands, at least not in the way that the Bite and Scale recognizes. A lot of my hypermobility comes in my shoulders, my hips, my ankles, things like that. So my hypermobility is not represented in the Bite and Scale. I got very, very, very close to what the score is on the Bite and Scale. However, again, because my wrists and my hands aren't hypermobile in the way that the Bite and Scale specifically wants, I didn't receive those points. So upon doing that, I walked away with a clinical diagnosis of HSD, so hypermobility spectrum disorder. However, it is very boldly written in my chart. I just pulled it up again, like very bold on my chart. It says, patient does not meet the clinical diagnostic criteria for hypermobile Ehlers Danlos syndrome at this time. However, in all caps, however, she has significant hypermobility in joints not assessed by the Bite score, specifically her shoulders and hips. This patient's clinical evaluation is consistent with a diagnosis of hypermobile Ehlers Danlos syndrome. So it was a weird kind of rock and hard place for her because clinically she could not put HEDS on my chart because I didn't meet the criteria. But her professional opinion, after having dealt with a ton of EDS patients, was that I did qualify. So that's kind of where the bright side of HSD and HEDS being treated the same is that there is no different in my treatment. I deal with those issues in the same way, regardless of what that clinical diagnosis is. Myself personally, if HSD, hypermobile spectrum disorder, is truly a spectrum of its own, I am pretty high up on the spectrum of like disability for it. I am also, like many other doctors, of the personal belief that HSD and HEDS are, if not the same, they are significantly linked in a way where it is a spectrum. Symptomatic hypermobility is a problem in and of itself, with or without EDS. I do have quite a few of the other signs and symptoms of EDS that ended up qualifying me, in her professional opinion. So if someone asks, I say I have EDS. When I'm speaking directly with a doctor, I have to like give that little note, that little, asterisk of this is what it clinically says, but this is what my genetic professional opinion is, and this is what it is, and blah, blah, blah. And I have to explain the whole thing, which is a little bit tedious. Luckily, I have an amazing primary care doctor now who understands and believes me and trusts me and actually wants to work with me on things. So that is wonderful in and of itself, that I don't have to like bounce around and explain this to a bunch of different doctors. But yeah, ever since I was diagnosed with HSD, HEDS, regardless, with being hypermobile, that has come some other diagnoses, particularly with the POTS diagnosis, which, like I said, I did discuss that in my most recent Shop My Stash video. I am currently not in any sort of formal treatment for EDS. I have tried physical therapy a couple times. The first time was before I even got my genetics testing back, and it was with somebody who wasn't well-versed in hypermobility, and he fucked me up like pretty bad. I did a physical therapy appointment, and then for about a week I had little to no shoulder mobility. I was in pretty extreme pain. He caused a flare. Unfortunately, he was doing his best. He just didn't know, and that's fine. I don't expect everyone to know everything about everything, obviously. But I did suspend my time with him, and then a couple months later I did try to go back into physical therapy. This was in the new year though. This was this year. And I did end up finding a physical therapist that was educated. He was well versed in hypermobility. He was very helpful. He did quite a few things. The caveat to that was he was actually retiring in March. So I didn't have very many appointments with him because bless the man's soul, he was like, listen, I'm taking a lot of time off between January and March. I got to use up my PTO. And I was like, fucking, of course, buddy. Like, I don't blame you whatsoever. I totally get it. But he was a wonderful, wonderful man. I did learn a lot from him in my time there. Unfortunately, it costs a lot of money. It's not something that I can currently afford to do financially. I also just don't have the mental capacity to try to find another physical therapist that is not going to hurt me more than help me. So currently I am not in any actual legitimate treatment for EDS. I'm just giving myself the accommodations that I need to help myself out. And that's the biggest thing. Like that in and of itself has made a world of a difference for me. Literally once the geneticist was like, hey, I want you to go get the blood work done, like this could be a thing, I immediately started researching like accommodations and how to help it and what to do, and I started applying some of those in my day-to-day life. Little simple things like if I'm at work and I need to lift something, passing that off to someone else, whether it be another coworker or whether it be the customer themselves, just basically being like, hey, can you help me out with that? Doing little things like that, protecting my joints, not doing things in ways that would go past my standard range of motion. World of a fucking difference, honestly. Has made a massive difference in my life to just give myself those accommodations and give myself that time to rest and recover and not go absolutely too far. Has just that alone has made a world of a difference. Like I said earlier, looking back, I had a lot of signs when I was younger. I really did. And that's honestly why I believe that awareness and advocacy are huge. Getting the idea of EDS in front of not only just people who could potentially have it, but also other doctors, other nurses, other medical professionals, educating them on not just what EDS is, but also just how incredibly common hypermobile Ehlers Danlos is. It would make a world of a difference, honestly. Just like I said earlier, if you someone has a chronic pain patient and they're not showing signs of, severe injury or past history of trauma, like injury to the body, or, they're not showing clinical signs of emergent situations, it's simply just being like, hey, you hypermobile buddy, like let's look into this. I think that would make a massive difference. Hopefully soon they can nail down the genetic marker for HEDS, or at least one of the genetic markers for HEDS, because being able to diagnose early is a massive, massive help to early intervention to prevent problems. If I had known at a much younger age the things that I needed to do to protect my joints and protect my connective tissue, I would not be in nearly as much pain as I was. If I had known at a younger age to strengthen these muscles in this specific way, I would not be in nearly as much pain as I am currently. So early intervention is obviously a massive, massive thing that needs to be dealt with more often, because it's the key to reduction in pain. So through my own diagnosis, I have met some wonderfully amazing people. I've made friends with other people with EDS, and I've cultivated a little community of people that I just think that they're such wonderful people. But it's so nice to have someone in my life have people in my life that understand what I'm going through, that you can bounce kind of ideas off of, that you can just vent to, it's just that community is key to me personally. I think that it's very, very, very helpful. And yeah, that's basically everything. So that's a little bit of my experience, my worldview on it, and a lot of the scientific and medical information on EDS. Like I said, I think that advocacy and awareness are massive and need to be more aware. More awareness is always good. There is no harm in it. I do think that there is absolutely a chance for harm to exist within like the TikTok medical community, the TikTok EDS disability community. There's absolutely situations in which there's not good medical advice happening, but I think that if it's being used as a springboard to help somebody understand that something that's wrong with them, I don't see any problem with it, unless, you know, they're just selling fucking fish oil and shit like that. But I hope that today's video was educational. I hope that it was enjoyable, at least. I am terrified to edit this because I just know that it's so long. But yeah, I really wanted to make this video to help spread even more awareness, to discuss my own condition a little bit more. Like I said, I've talked about it quite a bit on my channel, but I've never actually taken the time to deep dive into what is EDS and what causes it and everything like that. So I think that this video was really important to have on my channel. I hope that it was fun. I hope that it wasn't fun, it's a weird word. I hope that it was at least enjoyable and educational for you. Comment down below and let me know, are you somebody with EDS? Are you somebody that just happened to stumble across this video and you wanted to learn more about EDS? Are you just one of my regular subscribers and you like to watch my videos and now you've learned a ton about EDS? And comments are super helpful with the algorithm, and this type of video is something that I want pushed farther into the algorithm, if that makes any sense. Please subscribe if you have not already. It would mean the world to me. Like this video, ring the bell, do all the things. I hope that you guys have an awesome day. I'll see you guys in my next one. Bye!